this is, in my opinion, an interesting study because it aimed to recapitulate what has been shown in the large phase 3 Tourmaline-1 study. The Tourmaline-1 study compared Ixazomib plus Reftex with Reftex in patients previously treated with myeloma. They had to have 1 to 3 prior lines of therapy to be eligible for enrollment. And this big study, which included 772 patients, showed an improvement in the overall response rate from, I think, from 82 to 87% with the Ixazomib-based regimen. But importantly, the progression-free survival was in the order of 20 months as compared in the experimental group as compared to roughly 14 months in the control group. So this trial showed that the addition of Ixazomib is beneficial and improves response quality and particularly progression-free survival. So the study I'm going to report at ASH is a study which is a retrospective and prospective study combined and was conducted in 8 European countries, and it involved 48 institutions who are experienced in treating myeloma patients. And the study enrolled about more than 300 patients. And actually, the patients had to be were taking part in an early access program of Ixazomib. So, because Ixazomib was not approved in 2016 when Tourmaline study was published, Takeda took a move forward and established an early access program. And so patients had to have the same enrollment criteria, more or less, than in the Tourmaline study. They were of similar age, median age was 68 years, but they had more advanced disease when it comes to ISS stage. And they were treated with the combination Ixazomib-Reftex, and the overall response rate was 60%, and the progression-free survival, which was obtained, was 14 months. But I should say that the overall response rate, of course, was dependent on the prior treatment lines. And patients who had only 1 prior treatment line had a response rate of 64%, and those with 2 or 3 prior treatment lines had a response rate of 57%. And what is interesting is, in my opinion, that patients stayed on Ixazomib therapy for close to 11 months. So the treatment is tolerable, and then you have a long median duration of therapy. That means that the patients benefit from therapy, and so that fits very well, very nicely together. So as mentioned, the median progression-free survival was actually, I have to correct, it was 15.6 months, and it was longer in those patients with only 1 prior line of therapy. There it was 20 months, and in patients with 2 or 3 prior lines of therapy, progression-free survival was 13.6 months. I must say the treatment, the Ixazomib-Reftex, is very well tolerated. You see mainly hematological adverse events, and there may be some gastrointestinal toxicity in some patients, nausea, but that is really relatively minor. And when you look at the quality of life, and that was done in the Tourmaline study between the experimental group and the Reftex group, there was no significant difference. So in conclusion, in the clinical practice, this study showed that Ixazomib-based is an effective regimen. It's well tolerated, and it can be used in patients of all age groups, particularly also in elderly patients. And just to sum up, a response rate of 60% and a PFS of 15.6 months is something which is clinical meaningful and more or less repeats or confirms what has been shown in the Tourmaline-1 study in clinical practice.